नमस्ते भैया।
नमस्ते मनीषा जी।
जी
नमस्ते एवरीबॉडी। नमस्ते दीदी, नमस्ते सुंदर भैया।
So भैया, first of all, it's a very happy Deepavali. शुभकामनाएं दीपावली की। It's the 5th day of Detoxification, and today is the Annakut or the Govardhan Puja.
Yeah.
And tomorrow is going to be Bhai Dooj. So for this, I wish everybody, all my bhaiya and didis, a very happy festive season. And during this festive season, often we tend to either overstrain ourselves or neglect our holistic health, and due to a lot of physical activities, we at times we are not aware of the signals which the body is sending. So maybe Bhaiya will be able to guide us today. So very warm welcome to Dr. Sundaraj Perumal Bhaiya. He's here with us to take up this session forward and to guide us in many ways. We've been listening to him last time also. And many of the participants had put forward so many queries and questions related to the various aspects of holistic health. So with this, Bhaiya, I welcome you to the session, and I hand it over to you. And I request the participants, if they would like to interact about something, that will be good. We can see Vinod Gupta ji, Rani ji, Pavai Madeshwari ji. Namaste. Namaste, Pavai ji.
Namaste, namaste. I don't know exactly on what topic you are having today's meeting,
So Bhaiya will be able to tell the topic, Sundaraj Bhaiya?
Yeah. Am I audible?
Yes,
Yeah.
Bhaiya, perfectly audible.
Okay. I have a trouble connecting with my mic, so I'm using my laptop mic. It's okay if the audio is okay. So today, last week we have discussed about our Indian ways of
Vaccination,
vaccinating
ji Bhaiya.
and strengthening our immunity. And today, I would like to speak more about our immunity. And we all want a very strong immunity. But sometimes this strong immunity can also cause problems. Sometimes the same immune system, which is supposed to keep us safe and healthy, can cause so many tough diseases. So today I would like to speak something about about the autoimmunity, a phenomenon called autoimmunity, and I'll try to share my PPT.
Ji Bhaiya, so rightly said Bhaiya. While you're sharing your PPT, I'll just put forward a sharing or a discussion.
Yes, please.
One of my friend, Luna Nasir, she's working as a green IT head at TCS. And she's an engineer basically. And her husband is also in the same field of medicine. He's a professor at the KGMC, King George Medical University at Lucknow. And as most of us went through the corona phase and were infected by the virus, she too and the family was infected by the virus. Now, the problem which post-COVID she is facing at present is some kind of an autoimmune disorder.
Yes.
And due to which her body, physical functions, the body like the hands and the movement becomes very painful and restricted. And she has to go on steroidal treatment for the same. So while you are taking up the discussion forward, maybe I'll get some insight into it so that I can just pass on a word. I won't be able to do the justice to the complete discussion, but I can just pass on the word.
Yes, rightly said. So this is a very serious condition, and it's not just one or two diseases. There are so many diseases. I can say more than 100 diseases people suffer from if they don't have their immunity under control, and if the immunity starts attacking them. So I would like to take you put some light on this special phenomenon called autoimmunity. So my slide is visible, right?
Ji Bhaiya, nicely visible. And you're also visible at the corner.
Yeah. Thank you. Great. So the definition of autoimmunity is like this: a disease in which the body produces antibodies that attack its own tissues, leading to the deterioration and in some cases destruction of such tissue. So if our own body is producing some antibodies, normally antibodies, they attack the viruses, bacteria, and these help in restoring our defense mechanism and keeping us safe. But sometimes these immune cells, they get confused and they attack our own body, our own joints, our own skin, our own vessels, our own bones, our own organs. And whenever this attack happens, we get a wide range of diseases, more than 100 type of diseases, just because our immune system is overactive and confused. Normally, immune cells are thinking cells. They think and take decisions on their own. They will not ask brain for help. Our brain will not interfere with this immune cells function. In fact, see, when some hot water is poured on my hand and I'm looking at that way, still my hand sends a signal to the brain that something very hot is touching me. Instantly, brain sends another signal to the hand to move the hand from that place, and another signal to this hand to rub this hand. So this happens instantly, and brain is taking control. And if I have paralysis in this hand and I don't feel anything, and I'm looking that way, and hot water is falling on my hand, signal will not reach the brain, and brain will not tell anything, and it continues, getting burnt. So if the brain tells us what to do, tells the muscles, nerves what to do, then only this happens. But in the case of immune cells, when an immune cell looks at a bacteria or virus, it will not ask brain to decide whether this bacteria is a good bacteria or a harmful bacteria. It will think on its own, and it will take a decision whether this bacteria is a harmful bacteria, then it will attack it and kill it. If it is a useful bacteria, it will just leave it. So immune cells have this capacity of taking decision on their own. Sometimes they get confused because of various reasons, and they think that our own body cells are some kind of viruses or bacteria, and they tend to attack our own body cells, and this leads to autoimmunity. So immunity, immunis is untouched, that is the Latin word. And there are so many immune cells like lymphocytes, T cells, B cells, natural killer cells, neutrophils, monocytes, macrophages. Even skin helps us keep most of the bacteria and viruses away. It is a main defense mechanism. That is the reason why when people suffer with burns, immediately they get prone to so many infections, because skin is not there to stop the bacteria and viruses from entering our own body. And as I told you, these good bacteria which are there on the intestinal epithelial area, which is almost 2000 square feet, billions of good bacteria are there. Gut flora, we call them gut flora. This intestinal epithelial area, guarded by this good bacteria, also acts as a defense mechanism, and they will not allow the bad bacteria to enter, seep through the intestines. And of course, there are so many food items called probiotics and prebiotics, which help the growth of this useful bacteria, useful gut flora, which will also help us in strengthening our own immunity and strengthening our own defense mechanism. So these are all great things, great cells, and great this whole mechanism is a great mechanism as long as it is working properly. But if these warrior cells, if they do not know where to attack, and sometimes they get confused and they attack our own cells, then the problem arises. So generally, what happens when this immune system attacks us, that these are the signs and symptoms of autoimmunity. They tend to have one of the three characteristic pathological effects which characterize them as autoimmune diseases. Damage or destruction to the tissues. Our own body tissues get damaged because they are being attacked by our own immune cells. And altered organ growth. Sometimes a particular organ grows in a different way. Altered organ function, whether it is skin or vessels or some important vital organs, they will not function as they are supposed to. So all these things are seen whenever there is this autoimmunity. As I told you, there are more than 100 autoimmune disorders, depending upon which part of the body is being attacked by immune system. If the thyroid gland is being attacked by immune system, thyroiditis, Hashimoto's disease, Graves' disease. The bones are getting attacked by the immune system, rheumatoid arthritis, Rheumatoid arthritis is the common thing which we see. We say it Amavat in Ayurveda, where joints they get attacked by these immune cells. Then ankleizing spondylitis, where the whole spine becomes a single structure, all the smooth part becomes very hard, and the whole spine becomes like a bamboo spine. So then we have polymyalgia, and it depends upon which part of the body is getting attacked by our own immune system. If the muscles are getting attacked, again, the polymyalgia rheumatica, skin is getting attacked. There is this disease called psoriasis. Many people know about, some of their friends will be suffering with the psoriasis, where the skin peels away, lots and lots of unnecessary skin cells they get generated. And then there is vitiligo, where there are white patches on the skin, eczema, scleroderma. The lungs are getting affected, fibromyalgia, nerves are getting affected, peripheral neuropathy, diabetic neuropathy. Intestines are getting attacked, Crohn's disease, celiac disease, ulcerative colitis. Blood is getting attacked by immune system, leukemia, systemic lupus erythematosus, hemolytic dysglycemia. Brain is getting attacked, multiple sclerosis, Guillain-Barré syndrome, autism. So many diseases, as I told you, more than 100 types of diseases, just because our own immune system is overactive and attacking our own cells. So I have experience in treating autoimmune disorders, because nowadays lots and lots of patients are suffering with autoimmune disorders, and we are getting regularly these autoimmune disorders. I will just tell from my own experience. I have treated patients with ankleizing spondylitis, rheumatoid arthritis, psoriasis, vasculitis, systemic lupus erythematosus, multiple sclerosis, diabetes type 1, diabetes mellitus type 1, vitiligo, endometriosis, Crohn's disease, ulcerative colitis, Sjogren's syndrome, and sudden hearing loss. These are some of the diseases which I have treated. Let me explain some of these things to you. There is this ankleizing spondylitis, where the cartilage in between this particular thing, it slowly becomes bone-like hard part. So the smooth part which allows the bones to move like this, it gets fixed. And as you have seen in the picture on the left side, it becomes hard, and the patient will not be able to bend like this or move like this or move like this. The whole spine becomes a bamboo spine. So here the immune cells are directly attacking the cartilage and turning that cartilage into the solid structure, instead of keeping it as a lubricating and shock absorbing action is gone, and the whole thing becomes hard, and the whole spine becomes a bamboo spine like thing. So this is one of the most common diseases which we treat nowadays. And then there is this rheumatoid arthritis, where the lining of this synovial membrane which is there on the joints, the cartilage and the bone, whatever nice cushioning thing which is there inside between the bones, it gets attacked by the immune system, and the cartilage gets degraded, and the synovial membrane gets inflamed, swollen, and even the bone also becomes corroded, and slowly the whole joint, as you are seeing in the left corner, hands become completely deformed, all the joints become completely deformed. So this is seen in rheumatoid arthritis. Then, as I told you about the skin disease, psoriasis, here the skin tends to become red, and the flakes they peel off, they fall off. And I have seen patients whose entire body is covered with this psoriatic patches, and strange thing is they don't have any infection. There is no fungus, there is no bacteria, there is no virus, absolutely no infection. Just the skin cells, they are dividing at a rapid rate. Normally one cell grows, becomes mature, and divides into two. Within that time frame, psoriatic cells, they divide one cell into 10 cells into 100 very fast, and they don't form in a natural way. Immediately they peel off. So people have a lot of problems like itching, a burning sensation. Sometimes the psoriasis patients, after affecting the skin, the immune cells, they attack the joints also. Then we call it psoriatic arthritis. So all these diseases are happening just because the skin, the immune cells are attacking the several organs. And this is called vasculitis, where the vessels, blood vessels get attacked by our own immune cells. And then there will be lots and lots of ulceration, reddish patches, and the whole blood vessels, they become swollen and inflamed. And it is also a very tough and dangerous disease to treat. Then we have the systemic lupus erythematosus, where multiple organs get affected, get attacked by immune system. So you will see joint aches, headache, fatigue, hair loss, butterfly rashes on the skin, ulcers in the mouth, hemorrhage in the skin, and then there is pneumonia, pulmonary embolism, kidneys get affected, heart gets affected, blood gets affected. So many multiple organs get affected by systemic lupus erythematosus. Then there is multiple sclerosis, in which this is a disease in which the immune system eats away the protective covering of the nerves. Normally, nerves are like copper wires. Normally, electrical wires, the copper wire is there, and outside there is a plastic or rubber coating. Plastic coating is there. No? It helps us keep ourselves safe. It will not get an electric shock because it is insulated by this protective covering. Similar protective covering is there on the nerves. Nerves also, like they are like these electric wires where the electric signals pass. So the protective covering of these nerves is being eaten away by our own immune system. So the resulting nerve damage disrupts the communication between the brain and the body. And multiple sclerosis, it causes different symptoms like vision loss, pain, fatigue, impaired coordination, so many problems because of the multiple sclerosis. It's happening in the nervous system, in the brain, where the immune system is attacking directly the nerves. And then diabetes in children. Normally diabetes we see commonly in people, adult people, but some children, they tend to have this diabetes mellitus type 1 right from their birth, or it gets detected at the age of 2 or 3. And I am treating so many children with such type 1 diabetes. And here, the pancreatic beta cell destruction happens. Hence, the beta cells, islets of Langerhans, which produce this insulin, they get destroyed by immune cells. Our own immune cells attack our own cells which produce insulin. So there is absolutely no insulin production. So when there is no insulin production, automatically we start giving insulin directly to the kids of 5 years age, 6 years age. Directly we give insulin injections, and they maintain themselves on these insulin injections. And then we have this vitiligo, these white patches. Normally skin's color is being maintained by a pigment called melanin. This melanin actually keeps us protected from the harmful UV rays of which are there in the sunlight. So this particular melanin pigmentation gets disrupted by the attack of immune cells on our own skin. So wherever the immune cells are attacking, their melanin production stops. Whether it is in the skin or in the hair, the melanin production stops. So when there is no melanin production, the skin turns pale, white, and also the hair turns white. So this is also an autoimmune disorder where immune cells are attacking our own body, particularly skin and hair. Then we have this Crohn's disease and ulcerative colitis, where directly the large intestine is getting affected, being attacked by our own immune cells. There is a lot of inflammation on the lining of the colon. It leads to diarrhea, blood in stool, abdominal pain, urgency of motion, and weight loss. And there is this Crohn's disease, which will cause so much more destruction anywhere from mouth to anus. The entire digestive tract can get affected, and the ulcers, they penetrate through the intestinal wall, and they also involve the connective tissue surrounding the gut, and there are so many complications, abscess formation, abnormal connections, fistula, so many problems. So, and the entire thing is happening because our own body is attacking our own intestines, our own digestive system. Then there is the Sjogren syndrome, where the mucous membranes, wherever this mucous membrane is there, body has a way of keeping the whole channels wet and smooth and lubricated. These mucous membranes, they get attacked by this immune system. So dry eyes, dry mouth, and even the production of saliva will be reduced, production of tears will be reduced, and there are so many other problems like upset stomach, vaginal dryness, memory difficulty, speech difficulty, heartburn, respiratory conditions, pains and arthritis, liver problems. So many conditions happen in one syndrome that is called Sjogren syndrome. I have treated patients with Sjogren syndrome, and I have also seen patients with sudden hearing loss, sudden vision loss. Suddenly, absolutely, they become blind. They can't see anything. Immediately, doctors give steroid injections, and then they regain their vision. Suddenly, they become completely, their hearing is gone. They can't listen to anything. Suddenly, everything is gone. And of course, they take steroid injection, their hearing is restored. But slowly, after some time, these steroidal injections also stop working. So this is happening because the nerves related to this hearing and vision, they get attacked by our own immune cells. So there are so many other diseases also, but I'm just speaking about those diseases which I have treated till now, where I have experience. So there are some blood tests which show there is some kind of disruption and disturbance in the immune system, like ANA, CBP, CRP, ESR, ferritin, HLA-B27, RA factor, autoantibody tests. So many tests are there which will confirm the diagnosis of autoimmunity, where our immune system is attacking our own body. And what modern medicine is doing in this condition is like they give corticosteroids like prednisolone and other immunosuppressants like azathioprine, cyclophosphamide, mycophenolate, sirolimus, tacrolimus, HCQS, so many things. And ultimately, they all suppress our own immune system. Because the immune system is attacking some part of the body, we suppress the immune system. And when we suppress the immune system, instantly we get symptomatic relief. But unfortunately, when you suppress the immune system, what happens? The whole immune system gets suppressed. It's not like only those immune cells which are attacking the part of the body are getting suppressed. No, the entire immune system becomes weak. That is the major disadvantage of giving immunosuppressant drugs. Imagine we
Bhaiya, I think we've lost your voice.
Yes, there seems some network issue at
जी भैया.
the end. Yes. Sundarat Bhaiya is joining in a while. Till then, if anybody have any sharing, welcome.
Hello.
जी भैया.
I'm sorry, suddenly my laptop got restarted. I don't know. Yeah. So I'm just I'm trying to share my screen. Mm. So is it visible?
Ji bhaiya, it is visible.
Sorry for the inconvenience. And, so imagine we have this border between our country and Pakistan, and there are these our own soldiers, border security force, who are always guarding us from the intrusion of terrorists or Pakistan army into our own country. And there are some soldiers who are mentally disturbed or something happened and they are attacking our own countrymen, and we are unable to find out who exactly they are, and we wanted to control the situation, so we keep entire border security force under arrest because we don't know who is doing this. So what happens? The border becomes empty and we allow anyone to enter our own country, and it becomes a bigger disaster. Similarly, some immune cells are attacking our own body parts, and we don't know what they are, where they are, and we don't know how to stop them. So we suppress our entire immune system, and our immune system gets suppressed, and suddenly, so many other viruses, bacteria can enter our own body and they can attack our vital organs, and it can become a bigger disaster. So it is very important for us not to suppress the immune system. So whenever people come to us for treatment to any kind of autoimmune disorders, we try to reduce the dose of the steroids instantly, and after a period of 1 month or so, we try to completely stop the steroids, because we can't instantly stop the steroids. We gradually stop the doses of steroids, and we try to bring the immune system back to normalcy with certain therapies. We correct the food, we correct their lifestyle, we treat their body, and also we treat their mind, because most of the autoimmune disorders are psychosomatic in nature. Most of the people, their mind is so stressed out, they're full of tension, anxiety, fear, irritation, and so many other things. It triggers the production of so many free radicals inside the body, and these free radicals, they attack, they disturb the immune cells, and immune cells, they get disturbed, and they sometimes get confused and attack the body. So it is very important for us to treat both the body and mind. So that is what we do. So as I told you, these free radical production can happen because of this stress, because of the anxiety, stress, tension, depression, fear. And there are so many other factors like not eating in time, not sleeping in time, not getting up in time, not doing physical activity, and not eating healthy food, and many hormonal imbalances, so many things which can trigger the production of these free radicals, and these free radicals can disturb the immune cells and cause autoimmunity. So generally we do some detoxification therapies for people with severe autoimmunity. We do panchakarma therapies like vamana karma, where we try to give certain medicines which will enter each and every cell of the body, drag these free radicals out of each and every cell, then remove these cells and kick them out of the body. Remove the cells, remove these free radicals and kick them out of the body through the help of this therapy called Vamana Karma. Then we do another cleansing therapy called Virechana Karma. Similarly, this also has a similar action of removing these toxins from each and every cell of the body. Then we do some metabolism correction and immunomodulatory therapies called Vasti Karma. There are so many kinds of vastis depending upon which part of the body is getting attacked by this particular immune cells, and this helps in restoring normalcy in these disturbed immune cells. And there is another therapy which is called Masyakarma, which will act directly on the nervous system and calms down the mind and relaxes and reduces the stress. And of course, there are some special therapies called Jalu Kamacharna, Sira Vedana, where we use leeches to remove the bad blood from various parts of the body. And we do other procedures like Shirodhara, Shiropichu, Sarvangadhara, Kashayadhara, Dhanyamladhara, Kodajapatra, Agnikarma, so many other therapies. But the ultimate aim here is to restore balance in the immune system, modify the immune system in such a way that they will not attack our own body, modify them in such a way that they will keep protecting our own body and they will not damage any organs of the body. That is the aim. There are some special therapies where we have tried these special therapies in some specific autoimmune disorders. One is Keval Kshirpana therapy. For 48 days, we give only milk as food, nothing else. We give medicines and only milk. Breakfast, lunch, dinner, everything is milk. And in another kind of therapy, we give only buttermilk as food for almost 21 days, sometimes to 36 days like that. Only buttermilk, nothing else as food. Then we have some Vardhamana Kalpa Prayogas where we increase the dose of the medicine every day up till the maximum possible dose, and we decrease the medicine while giving some buttermilk or milk as a food. And we do all these things in different kinds of diseases. There are so many medicines which we use, and we teach them how to practice pranayama in right way. We teach them meditation. We teach them how to practice silence. Silence is not staying calm, real calmness inside the body, where they achieve this thoughtlessness state. So higher level of dhyana. And then we teach them non-judgment, where people keep on analyzing, over-analyzing and judging things, judging people, judging themselves. The famous Dr. B.M. Hegde, he says that this autoimmunity is happening because there is so much of hatred inside us. We hate others. When we hate others, we are hating ourselves. When we hate ourselves, our body, our own cells, they are hating themselves. They are attacking themselves. So when we overanalyze, why is this happening? Why is this happening to me? Why is this happening now? And what did I do? And we keep on analyzing things. We want to find answers for everything, and we pass judgments for everything. And we teach people how to practice non-judgment, because just by analyzing and judging things, we spend a lot of energy. A laborer who spends a lot of energy morning till evening working in this hot sun, doing physical labor, that energy expenditure is much lesser than what we spend sitting in a chair whole day, not even moving a single finger, and just keep on analyzing things and judging things, and that drains our energy. That causes so much of disturbance inside our mind and body, and that causes autoimmunity. So we teach them non-judgment. We teach how to prioritize in life, how to live stress-free life, how to practice affirmations, visualization, so many other techniques to gain this self-regulation, to gain control over their mind. That is the key to correct the immune system, and that is what we teach, and that is what we ask everyone to do. Those who are prone to autoimmune disorders, those who have such affinity, like some people in their family are suffering with rheumatoid arthritis or psoriasis or some other autoimmune disorder, and they come to us and ask, what should we do to avoid this thing? We say, eat good food, eat in time, sleep in time, do some physical activity, expose your body to sunlight, and do pranayama, dhyana, and keep your mind relaxed always. Stay healthy, then you will not get affected with any kind of autoimmune disorders. This is what we say. And of course, as far as food is concerned, we tell them avoid stale food, avoid fried food, avoid chilled food, avoid spicy food, avoid reheated food, avoid preserved pickles, bakery items, non-vegetarian food. All these things, they tend to increase the autoimmunity. Eat freshly cooked food, fresh fruits, fresh vegetables, A2 milk, Indian cow's ghee, gingerly oil, millets, pesticides free food, all these things are very good for correcting the immune system. So eating food in time, sleeping in time, getting up early, and doing some kind of physical activity. And some people, they eat food and immediately they run away. They rush to work. We say avoid hurry, worry, curry. So don't hurry. Just relax after some time. After eating, relax for some time. Don't worry about too many things happening around you. Just relax. Don't make your curry too spicy, too fried, or too overcooked. So prioritizing health and family above the career, and we tell so many things to patients. So yeah, I think this is what I wanted to tell you today. So if you have any questions on this particular topic or any other topic, I'm open to questions. So I'll stop sharing my screen.
Namaste, Bhaiya. I have one query.
Yes.
You said a detox procedure, detoxing is to be done. Can you see, we are in a hurry life. We normally tend to have a lot of spicy food, and sometimes even we have fatty food. So
Yes.
can you share the detox procedure to do at home, and once in how many days, and it can be done to to keep our body in a healthy condition? Can you share some point in this?
See, body itself has this wonderful way of detoxifying itself. So that mechanism is already present. All we have to do is allow it to detoxify itself. For example, every day in the morning we brush our teeth and take bath. Brushing helps in removing toxins in the oral cavity, and taking bath helps in opening up the skin pores and removing toxins from the skin. But that is not enough. So when you do some physical activity, when you allow um, when you allow the body to send these toxins out of the body in the various forms. For example, can you mute the mic of the person whose mic is on? And when just by doing some physical activity every day and letting the body sweat a lot, this sweat itself will remove toxins from each and every cell of the body. Every day, if there is some kind of physical activity which is allowing you to sweat a lot, that itself is a powerful detoxifying agent. So, of course, we in our holistic health, we have different ways of detoxifying each and every sense organ. How to cleanse the nose, cleanse the ears, cleanse the oral cavity, cleanse the eyes, and cleanse the skin, cleanse each and every cell of the body. We have spoken in detail about this part. And of course, we have also shown practically how to do all these things. And there is this video in AICTE-SIP channel on which this particular session is being live streamed now. So there we have a practical session video also, where we show all the daily detoxification procedures, which you can just look at and just follow it. So that is one way of keeping ourselves toxin free every day. Of course, not putting toxins inside the body, that is also very important. So when you put a lot of toxins, when you eat food infested with lots and lots of pesticides and lots of chemical fertilizers, then you are allowing the body to accumulate lots and lots of toxins. So choosing the right food, eating it in the right time, sleeping in the right time, allowing the body to send this waste out of the body easily, getting up early in the morning to facilitate better bowel movement. All these things will help in better detoxification. And still, if you feel that you need to have a strong purgation to have a proper detoxification. In our age-old tradition is drinking this castor oil, which is very safe. And even for small kids also, our grandmothers and grandfathers, they used to give this castor oil regularly, at least once in a month. For kids, 3 to 4 spoons of castor oil, proper well-treated castor oil. We used to do a nice cleansing of the intestines. Of course, it is only cleansing the intestines, but it will help in removing all the waste material stuck to the intestines. Some nice 3 to 5 motions will happen, and the whole intestines will get cleansed. So even we can try this for adults. Maybe some 20 ml of castor oil can be taken once in a month, preferably on the Saturday night, so that Sunday morning you'll have some loose motions, and the whole day you can eat very light food like soups and some dalia, something like that. So these are certain ways to detoxify regularly without supervision of any doctor. But if you have some kind of a specific ailment for which you feel that body needs to be detoxified, then you reach out to nearest doctor who will suggest you how to the right way of detoxification. As I have shown you, there are some seasonal detoxification therapies also. For example, this Vamana Karma, which I have shown, this thing is best when you take it in the Vasant Rutu, normally in the March, April, May months. So again, in the Sarad Rutu, we give this Virechan Karma. In the Varsha Rutu, we give Vasti Karma. So these are seasonal cleansings for even healthy people. But for a person who is suffering with a specific disease, particularly autoimmune disorder, we will give all the detoxification therapies and metabolism correction therapies in any season. So that a doctor will decide if you need such strong detoxification therapies. But for simple detoxification, as simple as 3-4 spoons of castor oil will help you. But regular detoxification in the form of sweating a lot, doing physical activity will help to keep your, many of us, we feel that sweat is a taboo, but that is not so. Sweat is a wonderful way of removing the toxins from the body. People, they don't allow the body to sweat. They use a lot of deodorants and other things which will seal the skin pores, and they will not allow the toxins to come out of the body, because if there are already toxins accumulated inside the body, the sweat is so, its smell is not good. The bad odor comes out of the body, and that is an indication that there are lots and lots of toxins. Body is telling us that, see, your sweat is so strong and so bad, so you have to do some kind of detoxification. Instead of listening to that, we don't allow the skin to remove these toxins, at least by itself. If not by the help of doctor, we are not even allowing it to do it by itself, and that will produce more and more toxins inside the body and cause very difficult diseases which are often impossible to treat. So it is very important for all of us to keep ourselves detoxified regularly, particularly sweat a lot, do some kind of activity, allow your kids to do some kind of activity where lots and lots of sweat comes. So that is the easiest way to detoxify yourself. Hope I've answered your question.
Yeah, doctor, I have a doubt.
Yeah, please.
You mean to say that because we are taking the immunity boosters, we are getting this disease?
No, definitely not. Immunity boosters are not causing autoimmunity.
Okay.
Immunity is getting disturbed because of various things. If you are not eating in time, not sleeping in time, not getting up in time, not doing physical activity, lots and lots of free radicals, they get accumulated, toxins get accumulated in their body. If you are overthinking, lots of stress, fear, anxiety, depression, irritation, this also produces lots and lots of free radicals. And these free radicals, they disturb our own immune cells, and the immune cells, they get confused and they attack our own body. So immunoboosters are not causing the problem. Immune cells are getting disturbed by accumulated free radicals, and that is the reason for disturbance inside the immune system. That is the reason why people are suffering with various autoimmune disorders.
Okay. Sir, can we take cow's milk in the night with the turmeric and pepper and palm candy? Some say that milk we should not take. Is it so? Or if I get pure cow's milk, can we have it?
You can happily take cow's milk if you get Indian cow milk, pure milk.
Yes.
Happily, every day you can drink. There are so many benefits of pure cow milk. It has wonderful effect on so many organs of the body. Even brain becomes very strong if you regularly drink cow's milk.
Okay. Okay. Thank you. Is there only one more question, please? See, if you are taking 1 cup of a coffee in the evening and only 1 cup of a tea in the morning 11 o'clock, will it have any negative effects or?
No, 1 cup of tea or coffee will not have any negative effect. Only people, when they get addicted to coffee or tea and they can't live without coffee or tea, then only the problem happens.
Okay.
1 or 2 cups will not cause any problem.
Okay. Thank you so much. Thank you.
Yeah, I have one question.
Yes.
Please.
We get the early age gray hair.
Sorry?
Is it a cause of early age we get a gray hair?
Early graying of hair.
Yeah. Is
As I
it
told
a cause
you,
of autoimmune immune system?
yeah, as I told you, this melanin pigment which is there inside our skin and also inside our hair. Actually, a hair is like a hollow tube filled with melanin pigment. When this melanin pigment is gone, it turns gray and white. So normally, after certain period of time, after certain age, slowly the hair tends to become gray. But nowadays we are seeing most of the youngsters, young children, where graying of hair is very common. So this is something again related to autoimmunity and also lots and lots of other factors. So sometimes excess metabolic rate inside the body, excess accumulation of pitta, and excess stress, acidity, and so many other factors also lead to early graying of hair. Autoimmunity can be one of it.
Okay. But yeah, I have one more question. Can you suggest a food which can consume so that which can be taken regularly so that it improves our autoimmune system? Like that maybe some foods or maybe some natural product which we use at the home can be used. Can you give a suggestion in that?
Yeah, as far as food is concerned, as I told you, freshly cooked food with lots and lots of vegetables, lots and lots of fruits, and all those things will keep our immune system strong. But as you might be knowing already, there are some herbs which are wonderful in keeping our immune system strong and wise. It's not like they are not just immunoboosters, they are immunomodulators. Lots of research went into these herbs which are immunomodulators. One such a herb is giloy or guduchi or amrita. So this giloy or guduchi, this herb is we use it very frequently in majority of the autoimmune disorders because this herb helps in correcting the immune system in such a way that immune cells will not attack our own body. So that is immunomodulation. We are not suppressing, we are not boosting the immunity, we are modulating the immunity, we are modifying the immunity in such a way that immune system will always do its own work in a proper way. So there are some other herbs like amlaki, which is amla. Then we have amla is a Indian gooseberry, is a wonderful immunomodulator. Then we have shatavari. Then we have estrimadu. So many herbs are there which will help us keep our immune system safe, and it will not allow the immune system to attack our own body. So we can, so one thing which we can regularly take, all of us can take, is giloy. Giloy is available everywhere. It's mostly growing as a weed, or if you go to any Ayurvedic shop, particularly Ramdev Baba shop, you will get 1 month dose of Giloy for just 15 rupees. So it's called a Giloy Quad Churna. You can just make a decoction out of it. You can grow this Giloy in your own house in a small pot. You don't even need seeds. Just take a small stem of Giloy, even if it is dry, just put it in the pot and put some water and it will grow. It is called Amrita. It will not dry. Even the dry Giloy stems also, they grow. So that is a specialty of Giloy. That is one thing. Every day take this much stem. It's not the leaves. The stem is having this immunomodifying property. So take this much thick and this long stem and make it into small pieces, put it in water and make a nice decoction and drink. So that itself will help us keep our immune system always strong. But as I told you, taking some immunomodulators or herbs is not enough. It's very important for us to keep our mind strong, have self-regulation, stay always happy, and also keep our lifestyle in the right way. These are the main things to keep our immune system strong and wise.
Nice, Bhaiya. So maybe if some more participants would like to put forward a query.
Thank you, Bhaiya. It's nice explanation. Bhaiya, I have one small doubt. Can I, ma'am?
Yeah.
Go ahead, ma'am.
Shall I?
Yes, go ahead.
Bhaiya, I just want to improve my immune system. So, other than the herbs, can you suggest any powders which can be made using the home items which are available at home and which can be used to boost our immune system? As example, like somebody suggested me to take kahi jeera and curry jeera. That is a black color jeera, and the other one is in a greenish color jeera, which is more bitter. And also they suggested to take add a little bit pepper with coriander seeds, and they asked me to make a juice and have it every day in the morning with the honey, just as a detox process, and that's to boost my immunity. Is it that good way or correct way to do it?
So I'm just listing a few herbs which you get everywhere, and these are proven to be wonderful on boosting and strengthening and keeping our immune system strong. And even government has recommended these usage of these herbs during the corona pandemic. Okay, so I'm just listing them down. I'm just typing on the chat window. And these things you can safely and regularly have without any problem. So now it is on the chat window: Ashwagandha, Tulsi, Giloy, and Amla. So all are wonderful immunomodulators. So if you can get all these powders: Ashwagandha powder 100 grams, Tulsi powder 100 grams, Amla powder 100 grams, and Giloy 100 grams. Mix all of them. Take 1 spoon in the morning and 1 spoon in the night. That is more than enough to keep your immune system strong as far as the herb part is concerned. And you should also, as I told you, keep your lifestyle and food nice to keep your immune system strong. And this is a safe combination. The ones which you have told, so the spices and other things, sometimes they can cause some problem in some people. So what I have written here is a very safe combination, useful for everyone with different constitutions.
Okay, yeah. Thank you.
Nice.
See, Ranganath ji is raising his hand.
Ji, Ranganath Bhaiya, namaste. Ranganath Bhaiya.
Unmuting, I am unmuting.
Ji.
Yes.
Hello, Dr. Namaste. How are you, sir?
Yes, I am fine, sir. How are you?
Yeah, I'm good. I am now in Vijayawada with my son.
Great, sir.
Yeah, I'm following your advice during Surya Namaskar. Instead of a cup of coffee, I do take a cup of milk. I feel a little bit good, but in the long run, I hope I may not have that reeling sensation during Surya Namaskar. Thank you. Shall I continue, sir?
Sure, sir, sure.
Yes, sir. Thank you, sir. Thank you. Sir.
Yeah, please
Thank you very
continue
much.
taking that milk and
Thank you, doctor.
for taking.
Oh,
Doing
sure. Yeah, sure, sir. One of my students also, it seems that he would like to have a clarity. He has some doubt. If you permit, he will ask. Sir.
Sure.
Not now. I hope he may. Sure. Thank you, doctor. Thank you very much. No, thank you.
Nice. So, if any more of our participants would like to put forward a query, or anyone from the panel, that will be fine. So we talked a lot about the immune system and how the immune system is getting confused due to our faulty lifestyle, and instead of being a panacea, it's instead of being a boon, it's a counter-attacking our own body parts, and henceforth causing some of the ailments that we had seen. So doctor, with respect to the joint pain and the stiffening of the joints, like one of the very good advice that I heard from you was to keep oiling the various parts externally. Now the point is, when we keep oiling externally, some of the oil does it get absorbed, or
yes.
what will be the best oil to use? For instance, like coconut oil, we at times in winters we use for oiling our body before having a bath. So for how long before the bath shall we oil our body, and what will be the best suited oil for especially the joints to maintain their flexibility and reduce stiffness and pain in it?
Yeah, generally this oiling the body, externally applying the oil, some part of the oil will get absorbed to the skin, but this application of oil will also help in increasing the blood circulation. It will also help in keeping the muscles strong and flexible. Once the blood circulation increases, nutrients, they reach that particular part if you do regular oiling to that particular part. And when the nutrients reach the body, all automatically regenerates wherever there is degeneration inside the joints and rigidity or whatever it is the reason. So applying oil regularly, even if absorption of little oil is one part, but regular application helps in increasing the blood circulation and increasing the strength of the joints, flexibility of the muscles and tendons and ligaments. So this all happens when you apply oil to the body regularly. And I have seen so many Ayurveda doctors who do it like a tradition every day. And I have seen some really old doctors, 95 years, 100 years, 105 years. Every one of them says that the secret of health is application of oil to the body every day. So generally we recommend the application of the oil to the body and doing some kind of physical activity, while exposing the body to the sun. So if you do Surya Namaskar or something like that, apply the oil and then do Surya Namaskar or some physical activity you can do, or you can sit and do some pranayam and meditation. And if you can keep the oil for at least 15 minutes to half an hour, that will help in so many ways. You need not do a lot of massage or rubbing. Just apply the oil to the body and do some kind of physical activity. That will be more than enough. And the right oil to use for regular daily application is the most suitable oil is til oil, gingerly oil or sesame oil. This til oil is the best oil to apply in all seasons, and for people belonging to different areas, different regions. Of course, in hot regions like Kerala and other places, they apply coconut oil, which has some cooling effect. In winters and in places where it is very chilling, then they use sarson ka tel, mustard oil, which has some kind of heating effect. So depending upon your own place, you can choose whether you can mustard oil or coconut oil or til oil. Til oil is suitable for all seasons, for all kinds of constitutions. So happily, everyone can use til oil. Even the Ayurveda oils, which we get different oils like Mahanarayan Taila, Prasad Nitala, and so many other oils. All these oils, they use this til oil as the base. Okay.
Nice. Thank you, Bhaiya. So this is something we got to know more to do with our everyday living.
Yes.
So application of oil to our body 15 minutes before the bath.
Yes.
And
Preferably hot water bath.
and yes, the hot water bath. That's very nice. So thank you, Bhaiya. As we can see that this today's session is again something which brings a lot of insight into the immune system specifically, and to eat fresh food and to remain active and follow the ritual of oiling our body before bathing. So, like as a little toddler, as a little child, the practice is very common in every Indian household. And as we grow, we give way to this, we give this practice away and become less aware of this particular practice. So that's very nice. Thank you, Bhaiya, for giving all the insight into boosting up our immune system and taking care of the immune system. Finally, the total body health is more correlated with our immune system. How active is our immune system? If the immune system is well taken care of and is fine, the body repair is automatically taken care of without much to do from outside. So that's nice. Thank you, Bhaiya, for this. And we'll call it a day today. As you can see, the firecrackers still being cracked.
Yes.
Yeah. Yet, though the crackers do have a lot of adverse effect on the environmental purity and pollution aspect, and it's really doing worse to the people with some kind of breathing disorders. And post-corona, since the lungs have become a little delicate, so that is not really something which is quite good. The smog that is being created due to all the fumes of the crackers that go into the air. So with this, Bhaiya, thank you so much for the session. We'll meet again coming Friday with more insight into some more topics. And thank you, participants, for all your active participation in today's discussion. So we'll Pavai ma'am, you want to say something?
Nothing. I wanted to say thank you.
Okay, nice. Thank you.
Thank you so much.
So thank you, Bhaiya. We'll meet again coming Friday. Until then, namaste.
Thank you,
Namaste,
Bhaiya.
everybody.
Thank you.
Namaste.
Thank you.
Shubharatri.
Namaste.
Thank you, madam. Thank you, doctor.